Hi, everyone. Good afternoon. This is Paige Hughes from the Alliance of New York State YMCAs. Thanks so much for joining us this afternoon for our webinar. We're super excited today to present this to you with our partners and friends over at Hunger Solutions New York, which some of you have worked with previously. The purpose of today's webinar is really to try to add to our statewide HEPA initiative. As you know, our goal with this program is to be able to make all of New York's kids and families who are in the WISE care as healthy and happy as possible. And today, Hunger Solutions is just going to share a few additional programs that can help us move the needle on this work and take it one step further. So with that being said, I'm super excited to pass it over to Misha Marvel and Krista Hestorfer from Hunger Solutions New York.
Hey, good afternoon, everyone. Paige, can you hear me okay?
Yes, you're good.
Okay, terrific. All right. Thanks, everybody, for joining us. And thank you, Paige, so much. We're really delighted to be here today for our webinar, Working Together to Reduce Hunger, Bringing Nutrition to Children Where They Live and Learn and Play. And as our Hunger Solutions New York logo implies, and as we hope to communicate today, we believe in the value of each of our parts to the work of the whole, that our nation's and our state's nutrition assistance programs really must work together to ensure that children have access to the nutrition that they need and that we all need to learn and work and thrive. My name's Misha, again, and I'll be starting us off today. And because we may have a broad audience on the webinar or listening later to the recording, including some WISE who may be experts in some of the child nutrition programs, and others who just may be brand new to some or to all the child nutrition programs generally, I'm going to share some background and context for why the programs are so important, and then I'll share some details about one underserved child nutrition program specifically. And then Krista is going to share some information about a few other programs that you may be more aware of, thanks to the work of Paige and the Alliance and the YUSA over the past handful of years. And then we're going to take some time for questions and answers at the end. And we hope that you'll leave our time together with a better understanding of the need for and the current reach of child nutrition programs in our state, how you and others in your community can get involved in a number of different ways. And again, because I'm sure many of you are community leaders and trusted messengers in a variety of areas, we want to make sure you know about some other child nutrition programs available to nourish our youngest children and families year-round. Those of us who are involved with outreach know that people may need to hear and see and read things multiple times from multiple trusted messengers before they reach out and connect with nutrition programs. So we're just so very grateful that staff from your WISE and other WISE across the state may very well be the trusted messenger that who helps a food insecure person or family access the food that they need. But before we go further, I should briefly introduce Hunger Solutions New York. We're a statewide nonprofit anti-hunger organization. We raise awareness of hunger in our communities, and we work to increase participation in the federal nutrition assistance programs that address hunger. And we do that through collaboration with national, state, and local partners. Specifically, we raise awareness of hunger and the programs to address hunger and the full range of benefits that accrue to individuals, families, households, and communities as a result of anti-hunger programs. We provide information and resources and technical assistance to community-based organizations, school administrators, teachers, parents, after-school program providers, and many other groups committed, and WISE, and many other groups committed to ending hunger. We manage outreach programs to provide direct client assistance at the local level. We advocate for policies that contribute to ending hunger at the local and state and federal levels. And our goal is to achieve full participation in the federally funded nutrition assistance programs for all who are eligible. And we work in partnership and in coalition with as many stakeholders as we can, because we absolutely believe that we are all more effective when we work together. One we think of as hunger is actually a scientifically measured concept through a number of different metrics and described in different but comparable terms. At times during the year, food insecure households are uncertain of having or unable to acquire enough food to meet the needs of all of their members because they had insufficient money or other resources for food. And food secure households include those with low food security and very low food security. USDA, the United States Department of Agriculture, monitors the extent and the severity of food insecurity in U.S. households. They do this through an annual nationally representative survey. The survey is the Food Security Supplement, and it's conducted by the U.S. Census Bureau as a supplement to the current population survey. The survey asks about 9 food security indicators, and based on the number and the type of positive responses, households are classified as either food secure or food insecure, which is further classified by low or very low food security. And in general, respondents are classified as food insecure if they report 3 or more of those 9 conditions and are commonly characterized by access issues and having to reduce food quality to make ends meet. Very low food insecurity generally meet 6 or more of those indicators, and they often report reduced food intake and disrupted eating patterns due to the lack of money or for food. FRAC, the Food Research and Action Center, is a national anti-hunger organization. They produce a data set on food hardship, which is a concept similar to food insecurity, but it's measured and it's analyzed separately. This analysis centers around data collected in response to the question that's posed in a Gallup Healthways well-being index. And the question is, have there been times in the past 12 months when you did not have enough money to buy food that you or your family needed? And FRAC has produced this data for the past 8 years. Feeding America offers yet another way to look at this issue through an annual analysis of USDA's data overlaid with other factors to result in a measurement that's particularly useful to local and community level food banks and food pantries. So on measures that help us get at quote unquote hunger, no matter how you slice it, the results are relatively consistent, which is good. And when our state is compared to the country as a whole, you can see here on this chart that we're doing slightly better in all 3 measures. But we still have many New Yorkers, about 1 in 10, living in food insecurity, and about 1 in 7 struggling with food hardship. And if we were to look at past year's reports, all of these data sets reveal a declining national trend in food insecurity, due in large part to the rebounding economy, decrease in unemployment, and an increase in share of eligible families using SNAP. But New York's food insecurity rates are relatively stagnant. The economic recovery just continues to miss those at the lowest socioeconomic level, and hunger continues to be a persistent and prevalent problem. And so specifically when we look at households with children, there's a marked difference between families with children compared to all households. Nationally, 1 in 7 families with children live with food insecurity. In New York State, nearly 1 in 5 families live with food hardship. And I do need to note here that USDA reports that parents often protect their children from food insecurity, even when the parents themselves experience reduced dietary quality and intake. And in some food insecure households, only the adults are food insecure. We see the consequences of childhood food insecurity every day in our schools and our communities. Research shows hunger affects children's healthy development and academic performance. In the summertime especially, or specifically, food insecurity contributes to summer learning loss, often called the summer slide. And this exacerbates socioeconomic gaps in academics, including reading. And I'm sure we've all heard of, quote, toxic stress. Hunger is equated to acute chronic stressors, and prolonged toxic stress can literally rewire a child's brain. disrupting their social competence and ability to succeed in life and in school. And this is according to the Center on Developing Child at Harvard University. The good news is that our nation's child nutrition programs help kids get the consistent access to high quality nutrition, decreasing food insecurity and supporting their health and learning. And these programs also have a positive impact on kids' health with improved diets, less obesity, and improved overall health. And these nutrition programs include SNAP, school meals programs, child care and after school meals, summer meals, and the program I'm going to focus on today next, WIC, officially the Special Supplemental Nutrition Program for Women, Infants, and Children. And again, we at Hunger Solutions New York approach the work on these programs in a variety of ways, including through statewide and targeted outreach programs, by providing information and technical assistance and other resources to community-based organizations, as well as schools throughout the state, and then also through administrative and legislative advocacy efforts. And then I should say, these are not all of the USDA nutrition assistance programs, but besides WIC, they are the entitlement programs, which means that everyone who qualifies and applies may receive benefits. And even though WIC is not an entitlement program, it has been fully funded for many years. And why am I focusing on WIC today in this webinar? It's because of who you are and because who WIC serves. When women are pregnant, they need vitamins and minerals more than ever. Good nutrition during pregnancy and in the first years of a child's life is crucially important. And research shows that women who use WIC have healthier births, and children who use WIC do better in school. And during this next bulk of time, I'm going to answer the questions we have here. What is WIC? Who's eligible? What are the benefits of WIC? How does WIC work? What are the benefits to your the communities and the folk that your wives serve, and the benefits of collaborating with the WIC Help New York program. And then again, we're going to save some time for questions and answers. So who's eligible for WIC? Someone may be eligible for WIC if they are pregnant, if they are a mom of babies up to 6 months old, mom of a breastfeeding baby up to 12 months old, and a child under the age of 5. The WIC program provides many benefits to pregnant women, new and breastfeeding moms, and children under the age of 5. And specifically, WIC provides nutrition advice, breastfeeding support, referrals to other services, and nutritious foods. And simply to qualify for and get WIC, a mom and or child must simply live in New York State. And have income below a certain amount, or get benefits from SNAP, Medicaid, or TANF. And something that might not be well known, and so specifically want to raise it, is that dads, grandparents, foster parents, and caregivers can apply for WIC on behalf of the children in their care. And this is why I'm focusing on WIC today, and why we are so grateful to the YMCA Alliance for helping us to spread the word about this. And just simply, many families are eligible for WIC but are not participating. And over the next few slides, I want to show you the coverage rate for WIC in our state and how it's changed over the past several years. The maps that I'm going to quickly go through now will show how WIC participation has changed over the past few years. And as you look at these maps to find where your county is, counties in green, the numbers are kind of small. Counties in green have at least 60% participation, and counties in red have less than 30% participation. And just to clarify, these are maps that we've received from the New York State Department of Health WIC program. So this was 2014. 2015, you can see how the colors are changing. 16, 17. And the most recent data is from 2018. And we can see from this data that the vast majority of counties in our state now have less than 40%. They're either in orange or red. So that means they have less than 40% participation among eligible pregnant and postpartum women, infants and children. So now that you get a sense that we have some work to do, I want to give you a sense of how WIC works, just to share some basics with you. Applying for WIC begins with the first appointment. And we should always tell families to keep in mind that each family member who is applying must go to the WIC office for the appointment. For example, if a pregnant mom is applying for herself and her 3-year-old, mom and the 3-year-old must both go to that appointment. And this is just something families should know so that they can plan for this. And I included this photo here because women can apply and participate in WIC as soon as they find out that they are pregnant. At the first WIC appointment, the family members will meet with a nutritionist, and the nutritionist is going to listen to their nutrition and health concerns. The nutritionist will do a health and nutrition check for each family member who qualifies for WIC. And if the family qualifies for WIC, they will receive an eWIC benefit card and a list of foods that can be bought with WIC. And then the nutrition is going to provide some appropriate referrals, for example, to Head Start or to Well Baby Care. We saw a photo of the WIC card in the previous slide, and this is some really good news about WIC. eWIC, electronic WIC, is here, and paper checks are a thing of the past. Some people listening on the webinar may have heard that in the past WIC food benefits were redeemed through a paper check, and that a family had to buy everything on their food list all at once in one shopping trip. That is no more. eWIC is a new way to shop with WIC, and the eWIC card acts just like a debit card, and it's swiped at the register. Families can shop when it works best for them. They can shop all at once like they used to, have to, or they could go back to the store as many times as they need until they use all their benefits just by the end of their 30-day WIC cycle of benefits. And we're not going to take the time in this moment, but we're going to send Paige the slide deck afterwards and send everybody the slide deck after. You can click on this hyperlink here that says eWIC is here, and then you can to view a short video that the Department of Health created, and then that explains more about eWIC. Another new benefit of eWIC is the WIC2Go app that can be downloaded to WIC participants' phones. WIC2Go will show a person their remaining benefit balance, show a list of the approved foods that they have. The app lets participants scan the barcode or the UPC code to see if a food, like when they're standing in the aisle, to see if a food is WIC approved. The app helps people to locate a WIC clinic and to find a store that accepts eWIC as well. And the app can even hold participants' next WIC appointment and check the dates and the times of their scheduled WIC appointments. I want to share some local resources available for many of you. We manage 2 community-based education and outreach programs, WIC Help New York and the Nutrition Outreach and Education Program, or NOAP. All of their services are free and confidential, and they're provided throughout their entire service area. And Krista is going to talk a little bit about NOAP later, but just want to give a context for WIC Help New York. Local WIC Help specialists operate out of community-based organizations in 20 counties across New York, any area here that's shaded in purple on this map. And if you visit the website wichelpny.org, you can find an interactive version of this map with the contact information for your local WIC Help specialist. WIC Help specialists can benefit the families that you serve in a variety of ways. They can conduct, or they are conducting outreach campaigns, presentations, and events in their service area. They can help applicants determine if they may be eligible, do a pre-screening as we call it. They can offer translation services, home visits, visit in person or over the phone assistance or through email. They can refer a person to the WIC clinic of their choice and set up and help prepare the household or the person for their first WIC appointment. And they can also verify the results with the WIC clinic, and they provide cross-referrals with other programs. And here are just a few ways WIC Help Specialists can partner with you and WISE to benefit families with infants and toddlers. If you're not in a WIC Help New York service area, I encourage you to use some statewide outreach as you're able to help direct families to their local WIC clinics. And when we send out the slide deck from today's webinar, we'll include some samples of outreach pieces. Those statewide materials drive people to WIC Help New York website, as well as the state's Growing Up Healthy hotline, so people can also get started with WIC that way. And we also have a variety of easily shareable social media outreach posts as well, if that's more convenient and efficient for you. And just to give you a specific example of how a Y and a WIC Help Specialist are partnering together, our WIC Help Specialist serving Cattaraugus County has been invited to the local WISE many upcoming events, as well as an open invitation to table outside the doors of their daycare center. And another great win for this partnership is that the YMCA's daycare is co-located with Genesee College. And so she gets to reach both groups of those parents. And so far this partnership is looking really hopeful. I see that my time is up, and so we should transition to the other nutrition programs that I mentioned at the beginning. And I'm going to pass the slides over to Krista. Thank you so much.
Thank you, Misha. From here, I'll briefly share about a few of the other federal nutrition assistance programs that WISE can help grow, starting with the Supplemental Nutrition Assistance Program, or SNAP. As you may know, SNAP provides monthly grocery benefits for individuals or families who meet certain income eligibility guidelines. Participants receive SNAP benefits through an electronic benefit transfer, or EBT card, that allows them to buy groceries at stores, farmers markets, and other participating retailers. SNAP is federally funded, it's state administered, and then it's operated locally by departments of social services, or in New York City, the Human Resources Administration. SNAP is our nation's largest anti-hunger program, serving more than 2.9 million New Yorkers. To provide some sense of the scale of SNAP, Feeding America states that for every one meal provided by their food pantry network, SNAP provides 12 meals. And SNAP is truly part of the suite of child nutrition programs. In New York State alone, over 1 million children benefit from SNAP, and overall, about 1/3 of all New Yorkers who receive SNAP benefits are children. There's a growing body of research that shows that SNAP can safeguard against food insecurity and improve health, academic, and future employment outcomes for growing children. Still, as with WIC, there are many individuals and families who could qualify for SNAP, but are not yet participating for a variety of reasons, including application barriers, stigma, or even just a lack of awareness that they may be eligible. As Misha mentioned earlier, our local level Nutrition Outreach and Education Program, or NOEP coordinators, help address these and other barriers to SNAP participation. NOEP coordinators operate out of community-based organizations in almost every county and all boroughs in New York State, any area that's shaded green on this map. And if you visit foodhelpny.org, similar to the WIC Help New York map, you'll find an interactive version of this map with contact information for your local NOEP coordinator. NOEP coordinators provide a range of, again, free and confidential services to help eligible people connect with SNAP. They conduct SNAP outreach. For example, they might be able to provide some flyers for you to display and distribute, or perhaps they could set up an informational table at your next community event. They may also be able to train your WISE staff on the benefits of WIC. They also provide pre-screenings to help people determine if they may be eligible for SNAP benefits, and if so, about how much they might qualify to receive. They can help people through the application process, including filling out the application and helping to gather and submit documents. And they work with local social services or HRA offices to ensure applications are processed correctly and in a timely manner. And if barriers arise, they help to resolve those barriers. They also provide referrals for other resources, including other nutrition assistance programs like school meals and summer meals. So if you aren't already connected, we definitely encourage you to reach out to your local NOAP coordinator to identify opportunities to help your members access SNAP. Next, I want to touch on a couple of programs that allow qualified WISE and other community-based organizations to directly serve meals to kids and teens. You may already have some familiarity with the Child and Adult Care Food Program, or CACFP, especially if you offer child care services. CACFP provides reimbursement to help eligible child care and after-school programs serve healthy meals and snacks to youth in their care. There are several different types of providers that fall under the CACFP umbrella, including after-school programs and daycare centers, of course, but also home-based daycare providers. CACFP is a great resource for all of these types of providers, and it has clear benefits for kids. Research shows that participation in CACFP is associated with healthier eating habits and increased fruit and vegetable consumption among young children. And for school-age kids and teens and after-school programs, CACFP helps ensure they're able to fully focus and engage in enrichment programming. Despite these benefits, as with all of the federal nutrition programs, CACFP remains underutilized nationally and specifically in New York State. The components of CACFP most relevant for WISE include traditional CACFP for your child care centers and the at-risk after-school snack supper program, or after-school meals, which is what I'd like to focus on today. The after-school meals component of CACFP reimburses for meals and snacks served to youth age 18 and younger in qualified enrichment programs operating after school, of course, but also on weekends or school breaks throughout the regular school year. To qualify, programs must be located within the enrollment area of a public school where 50% or more of the students qualify for free or reduced price meals. Because eligibility for after-school meals is based on the program's location, individual participants do not need to submit any type of household income application. Participating programs are reimbursed at set reimbursement rates. Currently, that's $3.41 per meal or 94 cents per snack. And if you have a program that's not located in an eligible low-income area, but you're still interested in providing after-school meals for kids, you may be able to do so through traditional CACFP, but there are some additional considerations. But please do feel free to reach out if you're interested in learning more about that option. I wanted to focus on after-school meals specifically because there is a really significant gap in access. In New York State, for every 100 children who eat free or reduced price school lunch, only 6.5 have access to a complete 5-component after-school meal. The majority of after-school programs in our state serve 2-component snacks instead of meals, but even if we include after-school snacks as a state, we reach fewer than 1 in 5 low-income kids with any type of after-school nutrition. So how can your Y help expand access to after-school meals? First and foremost, if you have an eligible after-school program or a child care center and do not already participate in CACFP, please consider applying. We're more than happy to talk through any questions you have, or if you're already on board and want to apply, please contact New York State Department of Health, the state agency that administers CACFP in our state, to start an application. If you already participate in CACFP's after-school component, but you currently serve snacks, consider switching to complete meals. The reimbursement rate for meals is nearly 4 times the reimbursement rate for snacks, and most importantly, serving complete meals provides a more substantial nutritional support to the youth in your care. Keep in mind that meals may be served at any time during programming, including immediately after school. And if your program is long enough, you can even serve a meal and a snack with at least 2.5 hours between those meal services. And please also help spread the word to other WISE and to other after-school program providers, including your local schools. We have a variety of materials that can help you learn more about CACFP and help spread the word in your community. Our newest resource, the CACFP After School Meals Guide, provides lots of information about after-school meals eligibility, the meal requirements, reimbursement processes, and more. And if you're able to promote CACFP on social media or in e-newsletters on your website, please feel free to use our web button graphics. I included a couple of examples on the right side of this slide. These graphics can be linked to our CACFP websites, afterschoolmealsny.org and childcaremealsny.org, so more programs and providers can learn about CACFP. While CACFP after-school meals provide an invaluable support during the school year, over the summer months, kids lose access to those after-school meals along with school breakfast and lunch. That's where summer meals come in, helping to fill the gap to alleviate food insecurity and mitigate summer learning loss, which can be especially prevalent among low-income youth. The Summer Food Service Program provides healthy meals and snacks to children and teenagers when school's out for summer. Meals are served at locations where kids learn and play across the state, including schools, parks, libraries, housing communities, WISE, of course, and other places where children might naturally gather in the summer. There are several different types of summer meal sites, but most often sites in eligible low-income areas operate as what's called an open site, meaning they're open to all kids who drop in for a meal. Locations can qualify to operate open sites based on school meals data or through census data showing the majority of children in that location qualify for free or reduced price school meals. And again, because eligibility is based on location, at open sites, individual children do not need to meet income guidelines or provide any paperwork or enrollment forms. The success of summer meals relies on those local sites and sponsoring organizations that administer the program and serve meals. Preliminary data from 2019 show that more than 380 sponsors were approved to serve meals at over 3,050 sites throughout the state, including 36 sites at WISE. I believe some of those WISE are on the call today, so I want to take the opportunity to thank you for all of your work. Even with so many sites operating across New York, there are significant gaps in access to summer meals. Last year, we took a deep dive into participation in the Summer Food Service Program to create a statewide status report. Our findings show that while statewide we're reaching about 27% of our low-income kids with summer meals, when you parse out New York City, where 36% of low-income youth eat summer meals, across the rest of the state, we're reaching about 17%, which is fewer than 1 in 5. We also found clear gaps in access in the last several weeks of summer. Even though over 2,900 sites in 61 counties operated at some point in 2017, fewer than 900 open sites in 39 counties were approved to operate after mid-August, leaving many kids without access to summer nutrition nearly 3 weeks before school started. And throughout the summer, we also see limited meal service on weekends. The full report is available on our website, so please do read and share it. We hope that it informs local conversations and efforts to help close these gaps. The good news is that there are a variety of ways that WISE and other community partners can get involved to ensure more kids have access to the food that they need year-round. WISE can help with outreach and provide referrals to ensure families know where to find meal sites near them. Another great way to partner is by bringing programming or activities to nearby sites. For example, your Y could facilitate recreational or enrichment activities at a nearby site. This is a great way to attract more kids and families to the local sites and to minimize stigma because the meal becomes part of a broader enrichment activity. And of course, WISE in underserved areas can make great summer meal sites themselves. If you're interested in becoming a site or helping identify other potential new sites in your community, USDA's Capacity Builder map is a great place to start. You can search an address and add layers of information, including whether the location meets eligibility guidelines based on census data. In this example, I searched for Albany, and the areas shaded pink are eligible based on census data. Then I selected a few other layers so I could see where sites operated in 2018, and then where the local libraries are, knowing that they can be great sites or partners to expand access in those underserved areas. If you are considering becoming a site next year, please reach out to a local sponsoring organization in your area. In many cases, these sponsors can take on additional sites under the wing of their sponsorship. They may also be interested in partnering with your WISE in other ways, like outreach or programming, as I mentioned earlier. Our sponsor directory can be a helpful resource to find the appropriate contact information for sponsors near you. You can find that sponsor directory and the capacity builder map on summermealsny.org, along with a number of other resources, including information on how to locate sites so you can refer families to the sites most convenient to them. There are several ways to find sites, including calling 211 and utilizing several texting hotlines. USDA maintains an interactive online site finder map, which we embed right on summermealsny.org. And we also keep a running list of New York sites that we keep updated weekly in case it's helpful for you to have that information in a list form. You'll also find a variety of outreach resources, including sample social media posts and flyers and rack cards, like the examples here, that you can order in bulk at no charge from the New York State Education Department. You can also use our web button graphics to help spread the word about summer meals. I have one example on the bottom right of the slide here, but these graphics are available in several different versions. You're welcome to embed a graphic on your website, share on social media, add it to your e-newsletters, and link it to summermealsny.org so people can click right over for more information. And while these resources are geared toward helping families find sites during the summer months, this time of year, you can also help raise awareness of the need for more sites and community partners to get involved ahead of next summer. We have additional resources and web button graphics with messages that encourage more community groups to consider serving meals or helping with outreach. So please consider sharing those resources as well. And as an additional resource for you all, as you may know, Bridget Gates of Watertown YMCA serves as a Y Regional Facilitator for summer and after-school meals. She is more than happy to talk through these programs peer-to-peer, so I've included her contact information here. We are just about out of time, so I will wrap up with a few action steps that we'd ask you to consider. If you aren't already connected with your local WIC Help New York specialists and NOAA coordinators, please do reach out and explore opportunities to share information with your members and the broader community to help increase access to WIC and SNAP. Also consider opportunities to serve meals directly through after-school and summer meal programs as you're able. And please help spread the word about these programs to other organizations and schools in your area as an ambassador for child nutrition programs. To recap, here are the websites we maintain with resources for the suite of child nutrition programs available to nourish infants, toddlers, and older kids year-round. We're also very active on Facebook, Twitter, and Instagram, and have e-newsletters if you'd like to like us on social media and sign up to get alerts about all of these programs. And of course, please also feel free to reach out if we can assist your work to support children and families. We are so grateful for your efforts and hope that you'll consider us partners and resources for you. Thank you again for your time, and thank you again, Paige and the YMCA Alliance, for partnering with us on this webinar. We are happy to take any questions at this time. Okay, so I have one question here. Somebody asked what they should do if there aren't sponsors operating in their area yet for summer meals. And in that case, I would suggest that you reach out to the New York State Education Department. I have their phone number here, and we'll send all of this information along to Paige to share with you all. Their phone number is 518-486-1086. And of course, you can always reach out to us here to explore how to handle that situation as well. And we've got somebody who's,
sorry, this is Paige. Finish your question first so I can go last.
Sure. So we just had a request about policy advocacy. I think Misha mentioned at the beginning that we do some legislative and administrative advocacy. And so I would suggest that people do sign up. We have an advocacy listserv, and that way you can get information about child nutrition reauthorization, which may be interesting to folks on the line. And Paige, do you have something?
Yeah, so first I just wanted to say thank you to you and Misha for today's webinar. I think this was really fruitful, no pun intended, as far as trying to figure out how WISE can greaten their impact to conquer childhood hunger. Quick question for you both. As far as the NOAP coordinators go, who ultimately ends up serving those counties who don't have a presence of a NOAP coordinator already? For example, like I saw Essex County, we have a YMCA up there. They don't have the presence of a NOAP coordinator. So who would serve that county or that Y in this case?
Right. This is Misha. So in those examples, we would encourage folk to reach out to us, and we will connect them with somebody here who can walk them through what their needs are, but we don't have that localized service in that area at this time. Those counties are the NOAP coordinators, and the contracts for that outreach grant are on a several-year grant cycle. I do believe the funding cycle for that is coming up this next year, and so we will be putting a new RFP out across the state. So if people are in an area where there is no current NOAP SNAP outreach work now, please encourage community-based organizations to apply so that we could bring NOAP service into that area in the future. So it doesn't really necessarily help people in this moment, but hopefully could remedy that issue in the future. But in the meantime, please reach out to us. I'm not seeing any other questions. Paige, do you see any other questions?
I'm not seeing anything on my end. I think we're good.
Terrific. Well, again, thank you again, everybody, so much. We'll get out the slide deck, and this webinar is being recorded, so I know we went through slides fairly quickly. So if people have access to both of those, to reference in the future, and we'll send the follow-up materials that we had promised along the way as well. So thanks again.